It is July now. I can't believe it. July 1st. It's a Monday. Um, I've got some work later today, which is why I'm dressed up. We'll create some more content today. Got some meetings. And I hope that you're doing well. So, on YouTube, I'm having fun chit-chatting, even though there's not as big of an audience at this time. But I've got my pup Leia here, and we're just playing outside for a little bit before the day is fully started. And if you're seeing this, I hope you're doing well. Leia, whoop. So, let me know if there's anything you want to talk about, if you want to learn about. Again, I'm an allergist. I'm also board certified in pediatrics. I take care of all ages, so we can chit chat about anything. If you're seeing this after the live stream, just put in the comment section as potential topics for me to discuss, and I'm happy to talk more about it. You ready? All right. Good job. Let's take a look. Leia, sit. Yeah, she's teething right now. She is teething. We had a nice walk this morning. Now we're getting a little bit of playtime in before the day gets started. Oh, thank you. Yeah, she is cute. She is cute. So, this is something I'm trying to do with YouTube live streaming, is just give you a sense of some of the things I do on a day-to-day, but also teach at the same time. And you get to see my pup grow up, so it'll be fun. And, oh, I know. You got to bring me the ball, though, or we're going to have a little hard time here. So, where are y'all coming from? Let me know. I'd like to know where my audience is. All right. Chase after it. There we go. Yeah. You're in medical school in Rhode Island? That's awesome. What year are you? And do you know what you want to do when you finish medical school? I personally wanted to go into pediatrics pretty early on, and that's what I ended up doing for residency. But I decided to do a fellowship in allergy to become an allergist. Good morning, Vivian. You're in South Mississippi. Meggles is from Maine. You're about to enter your second year thinking child psychiatry. That's awesome. We definitely need a lot more child psychiatrists. That is in demand. A lot of specialties that are in demand right now, and there is a significant shift in healthcare, and we definitely need a lot more mental health support and primary care. That is for certain. Oh, you ready? You ready? Ooh. So if there's anything that you want to learn about, just write it in the chat section, and we can start off talking about various topics this way. That's kind of how a lot of these live streams go. If you haven't seen me do it on other platforms before, I like to kind of go off on tangents of various medical topics to teach people just kind of on the fly. Oh, your mom's a pediatric allergist, and then she thought she was doing primary care. So yeah, it's basically what I did. That's awesome. Yeah, what's cool about allergy is that it's one of the few fields. You also have palliative care and sleep medicine, where you could start off primarily taking care of one age group, and then when you specialize, you can take care of all age groups. So you could have internists taking care of kids, pediatricians taking care of adults. You know, there's also the internal medicine pediatric track where you do both in residency. So it's really nice that way. It's a beautiful day today, by the way. Yesterday was a beautiful day. I spent most of my time outside. Today won't be as much. I have a lot of work to do. But we're getting some outdoor time and hanging out with y'all here for a little bit. Yeah, Leah, you're just chilling, right? You're just chilling. So one of my latest videos I posted yesterday evening, Simone Biles had asked a question about what causes her lips to be dry, cracked, peeled when she uses different cosmetics on her lips. So I talked about a concept called allergic contact cheilitis, which you can feel free to take a look at that video on my profile if you're interested. I can't say, and it's not responsible of anybody on social media to diagnose people on social media. So, you know, I kind of point to the topic. I can't say what exactly is triggering, but just brings up ideas for potential ways to help out, which is, you know, you might need to consider something called a patch test, where you put various chemicals in the back and let it sit there for several days. Yeah, you ready? You ready? Okay. Allergists don't typically treat lupus and Sjogren's. We learn about autoimmune diseases, but unless you're somebody who's really comfortable doing that, or I had a colleague who was triple boarded. They did internal medicine, rheumatology, and allergy. Like, you know, there are people like that can take care of all of it. Part of the issue is that when you start branching out into multiple specialties like that, it becomes more difficult to be able to manage all of it, not because of the knowledge base, but because of the resource base. So if you're out in the community, you may not have the right nursing staff to help you with all of the, you know, prior authorizations, because a lot of the treatments nowadays are with these very expensive medications that are very effective, but you need to have the staff behind you to be able to get all that done. And that's a challenge in the community setting. So if you're in an academic setting, you've got all those resources, it's different. How do the allergy levels on the skin scratch test? So when you do an allergy skin test, we basically take extracts of what you may be potentially allergic to. So let's just say if we're talking about the environment, like birch tree pollen, different species of dust mites, etc. We take liquid extracts of those, and we put that on your skin and scratch your skin. So a tiny amount of it gets introduced to the very top layer of your skin, and there are surface mast cells. These are part of your immune system. If they have on their surface an antibody called IgE, a protein tag that can latch onto those proteins that we introduce into your skin, it can release the chemical histamine, and histamine causes your blood vessels to get leakier, and it creates that hive. And so when I see a larger skin test, that basically tells me the likelihood of having a reaction is highest with those skin tests. That's what it basically tells me. It doesn't always say this is the more severe allergen. You can't always predict that. But to say like, oh yeah, this is more likely to be a problem, you know, of some sort, that's what that basically tells me. So the larger the skin test is more about likelihood of something being sensitive to it. See, when people ask questions like that, that's what I like to do. Expand upon those topics. Oh. We'll wait. You ready? See, she's starting to learn that she's got to back away if I'm going to throw it to her. What else would you like to learn about? And feel free to share this live if you think people would be interested in learning. I'll be on for a little bit longer, as long as the signal's good and I don't get any phone calls. I'm allergic to pretty much all the trees and grasses around here. stop shots but need to restart. I'm congested. I take after my mom. Yeah, you know, allergy shots, they can last for a long time for people, but it's not technically a cure and it can revert, especially if you don't do it for a long enough period. So if you only do it for like a year, it may help you, but it's not going to last that long. Your immune system will forget the benefits. Yeah, so what else would you like to talk about? I think on lives here you can actually like click like the like button that helps push out the live too. But you know, give it a train a second. I taught you correctly how to use a nose spray. Oh, good, good. I make those videos on a regular basis because I always reach new people. So if it's repetitive, if you ever see it, please watch it again and share it because it's a good refresher, but I'm trying to get to as many people as possible because I have had so many people who don't use it correctly or don't realize that you need to take it for longer. And when they learn that simple trick, it can make a difference for people. So you have to give it you got to give it a chance. 7-year-old gets horrible cough every fall that lasts until spring. The cough lingers until it turns bacterial and needs antibiotics. Beneficial to get allergy testing done. A chronic cough, you know, could be due to allergies, could be due to asthma, could be due to reflux. If there's a seasonality to it, then allergy testing could make sense. It could, because if we're hearing that it's fall through until spring, then there could be some pollen involved. It could be an indoor allergen involved. It could be several things, but also it could be asthma too. A chronic cough could be asthma. So definitely worth having your doctor get it checked out. It's a great question. But yeah, a child who's having a cough for 6 weeks or more should definitely be evaluated. That is for certain. What else would you like to talk about? So these live streams are for your benefit to learn about different topics for me. I'm an allergist in the western suburbs of Chicago. I work at 4 different locations. I rotate a lot. Typically Tuesdays through Saturdays. And so I just really enjoy trying to raise awareness about my specialty because there's so much that we actually do that people don't realize, and it affects millions and millions of people, and it's often under-recognized, and there's not a lot of specialists like myself doing this type of work to give educational outreach. So I really enjoy this. And now I get to share it with you with a puppy. She was diagnosed with asthma after 2nd round, but then every other time she got a severe cough, her lungs sounded fine. So we were stumped as to why the cough was lasting months. Keep in mind that asthma, you do not have to wheeze to have asthma. You could just have what's called cough variant asthma. And there can be many triggers. So I'll just give a little bit of a talk about asthma for a second. So asthma is a chronic lung disease. It's classified as being obstructive, meaning air has a hard time getting out of the lungs. So that's different than like having trouble getting air into the lungs. And so what's happening at the level of the airway, in the lower airways, is that you have inflammation that's abnormal. So the immune system is kind of constantly active. You've got mucus being produced in the airways, which makes it smaller. And then the smooth muscles that line the airways are tightening, and that's called bronchoconstriction. So inflammation, mucus plugging, and bronchoconstriction are kind of the 3 hallmark features of the disease. And there are various triggers to make asthma symptoms occur. And asthma symptoms, we think of coughing, wheezing, shortness of breath, chest tightness, and or difficulty breathing are the hallmark symptoms. The triggers can be identifiable. So cold air, change in weather, exercise, strong emotions like laughing and crying, getting sick, allergen exposure, irritants, and other types of infections, not just viral, but other kinds of infections can occur. So you can diagnose asthma through, obviously getting a good history, good exam. A lung function test is a breathing test where you're blowing in and out of a tube very fast and trying to see, are you having trouble getting that air out? So that we do that test and then give you a medicine called albuterol and do the test again to see if there's significant improvement. Albuterol is a medicine that makes asthma reversible. It's another classic hallmark finding of asthma. It's a reversible disease. If you take albuterol, which is called a beta agonist, it's going to reverse the symptoms by opening up the airways. And so the type of asthma that people have is variable. So we talked about cough variant asthma where you don't really wheeze, but then there's classifications based on the severity and frequency of symptoms. So people who only need a rescue inhaler every so often, they're usually classified as having intermittent asthma. If you have symptoms that are more frequent, they're considered persistent and subcategorized as mild, moderate to severe based on how frequent the symptoms are, whether they're more than 2 days a week, every day, are they happening multiple nights a week, waking you up earlier than usual? Is there impairment in your lung function on the test that's severe? Or are you having multiple asthma attacks, we call them asthma exacerbations, requiring you to take a medicine called prednisone or prednisolone, a systemic steroid. Systemic steroids are used as kind of a, somewhat of a last resort, so to speak, when we're really struggling to breathe or the symptoms are lingering for a long time. That basically turns down the immune response everywhere, which helps with the breathing, but can have a lot of side effects. So if you have more persistent symptoms, you may need to take daily medications like an inhaled steroid. It's a tiny dose compared to the oral pills that people may have to take, but it can kind of be like this protective coat to significantly reduce the chances of having asthma symptoms. And then if you know your triggers, you reduce exposure to triggers. And so that's a general overview of asthma. Make sure that if you're ever prescribed medication for asthma, that you know how to take the medicine. Talk with your doctor, talk with your pharmacist, because a lot of people don't know how to take their medicine correctly, and I have videos on that. N95 masks are effective for allergies because it filters out most of the particles if you're wearing them. You also need to wear eye protection as well. It's not going to affect any skin issues that you may have, but it can significantly improve sinus issues. So it filters out most of the allergens that you may come into contact with. So early on in the pandemic, there were actually studies done where they talked to healthcare workers who had significant allergies, and they consistently reported less symptoms. I found that my patients were doing a lot better in the beginning of the pandemic compared to now when most people are not masking at this point. Plus, when you get sick, it can make your allergies worse. Peds didn't want to do nebulizer, but she doesn't use inhaler with spacer well. Yeah, so in terms of the different medicines, a nebulizer is useful for patients who don't use spacers. Have another conversation with them and say, hey, my child won't use this. It's effective. Can we talk about a nebulizer? Just you may have to be a little more persistent with asking for what you need. I personally am not a huge fan of nebulizers from a convenience standpoint because it takes so much longer to use them. But I understand that a lot of kids aren't able to use a spacer with mask, and they just would rather sit there and watch some TV for 15 minutes or whatever. I'm allergic to beef, but not goat or lamb. Is this related to alpha-gal? So here's the thing. With meat allergies, you can have just an allergy to the protein itself. right? So alpha-gal syndrome, that's different. That is where you're allergic to a sugar that's found in mammalian meat called galactose alpha-1,3 galactose, or alpha-gal. That's a little different. So if you have alpha-gal syndrome, you'd be allergic to beef, goat, and lamb in that case, because the sugar molecule is found in all of them, versus the protein has different structures. And with alpha-gal syndrome, it's usually because you were bitten by a specific tick called a Lone Star tick. There may be other insects implicated as well. So I hope that kind of helps clarify the differentiation between it. Yeah, so feel free to share this with other people. Yeah, no problem. Probably have time for a couple more questions. Does high heat and humidity exacerbate asthma? It can, potentially, especially if you're exercising in the middle of that. But typically, it's dry air is worse than humid. But everybody's different. If you find that makes your asthma worse, then it's a trigger for you. But that's a great question. The weather change itself, when you have significant changes in temperature, that can lead to the smooth muscles contracting, leading to bronchoconstriction. Oh, I'm glad this is helpful, Ash. I'm glad. Yeah, it would be nice to be able to grow this YouTube channel, especially because if you don't know me from other platforms, I have over 1 million followers on TikTok and over 300. The long form videos are not really pushing out as well as like the shorts that I have here on this platform, but just trying to figure it out. So any help is greatly appreciated. So any other questions? If not, I will. Oh, here we go. Is it possibly allergic to your own sweat? Yeah. So there's something called cholinergic urticaria. That is where, when you're exercising, you could have hives where your sweat is. So it's unclear if it really is the sweat or the elevated body temperature, or maybe both. But theoretically, that might cause you to have these little tiny hives. That's a chronic condition. Oh, the thunderstorm asthma video made you realize why you felt so crappy afterwards. Yeah, so if you have asthma and there's a major thunderstorm, that the change in pressure, change in temperature, the movement of different allergens because of the severe weather can significantly impact your symptoms shortly afterwards. So you have to be careful. If there's a major storm, you really need to stay inside as much as possible. And even consider trying to stay inside a little bit longer after the storm is over to reduce the chances of getting sick. I remember seeing reports from like Australia where they have like major storms where there'd be these significant increases in ER visits due to asthma. Oh wow, we've been live for, this is the longest I think I've been live on this platform, and we've had some really good questions here, and I hope if people are seeing this afterwards that they've learned something. Happy to keep doing this, but for now I think I'm going to head out here. So like I said, please, if you are interested in learning more content like this, just interact with my content. You can go through all my videos, share them with other people so that they all learn about it. I'm trying to grow this channel to help raise awareness about different allergic conditions: asthma, eczema, food allergy, drug allergies, allergic rhinitis, chronic sinusitis, contact dermatitis, all that kind of stuff. So we can learn more, since it affects so many people. And I appreciate your support. I hope you have a great start to your week. Just let me know if you have questions. You can put that in the comment section of the different videos, and we will all learn together. Okay, take care.